Hey everybody out there in YouTubeville, so Danny G, you don't need me to introduce Coach Trevor, but there's Coach Trev. And I just want to have a little talk with you. So what do you know about having busted up knees, busted up shoulders, busted up joints, just like busted up body parts after a lifetime? What do you know about having busted up shoulders and body parts, bro?
So I've had knee surgeries, multiple shoulder surgeries, and I mean pretty much I've torn multiple different muscles and just infinite number of injuries from bodybuilding and other things. The knee is actually, where you can see the scar going all the way up my leg. It was actually an accident. I went down the stairs wrong, and I had these on the steps. My pant leg went under my shoe.
You mean you had your high heels on?
Pretty much. And I took a step, taking the trash out, and this one popped out, and it was about 17 flights down. So instinct, just natural instinct, you put your other leg out and you're trying to catch, and then next thing I know, I'm waking up in the emergency room and my legs are just twisted. And
how much did you weigh back then? Fall 17 flights.
270s, around the 270s at that time. So yeah, this
Get a little bit of momentum by the bottom then, did you?
Yeah. So there was no stopping that for us. It was going to happen either way. So that's the only non-gym injury that needed surgery. So, but that's what ended up happening.
So what the doctors, what was the, what they tell you, what kind of injury, like what they give you in the future? You're going to be on a cane, or they tell you like what?
So when I was in the emergency room, they have to fix whatever the problem is that they can fix at the time, and then from there on, you would have to make an appointment with another orthopedic surgeon and correct all the minor stuff. So I had a complete separation of the quad tendon. I had a tear in the IT band. My meniscus was torn. I had 1 centimeter left of cartilage. The ACL, LCL, there was tears all around the ligaments. So basically, this one, after about 8 months or so, I was able to start walking again on this one. But what they had told me in the beginning, they didn't tell me, they told my mother, because there's nerve damage also in this one, that I might not be able to walk on it. I ended up actually being able to walk on it, and then after going back to the orthopedic surgeon and doing the x-rays and the MRIs, there was less than 1 centimeter left of cartilage in there. And it was the reason my progress stopped in the doing physical therapy, and it just got worse. I would walk and it swells up and it would lock up. It's been one of the most painful things I've dealt with since then. And so I'd been dealing with that since, and they had told me that this one just needs to get replaced. They can do a surgery where they put basically a fake tissue. There's one where they say they regrow cartilage and then put it in there, and basically the padding between the knee or the meniscus, and they would insert that, but the success is it's not a very good success rate. It ends up happening again. It doesn't work for everyone.
I think I've heard that it like only lasts for a certain while even when it does work. Or
yeah.
Is that the same treatment?
Yeah. So you have that factor too. So they were saying just do it a total knee replacement was the easiest way. And I was supposed to get that done.
You were telling me before that that's actually standard operating procedure. They're like because it's the fastest time without the fastest downtime, and
they say you're walking. I've had multiple friends actually get it done. They're walking in 3 to 4 weeks or so.
But you're never going to put weight on that much, right? Or is that
am I wrong? No, you can put weight on. You don't have full range, and then you're living with a fake body part.
Yeah, bionic, but like.
And these ones are a newer generation, which is why people are walking so fast. It's an easy surgery. However, also, if you look at past operations on fake joints and such, you always have problems in the future. So it's too early to know. You can't just be taking out body parts and replace them and think that you're going to be just dandy. Yeah, it's too early to know what the future side effects of that is, because you see recalls all the time for these things. Right. So that was kind of something I pushed off.
So you're bulletproof till you're not, and then you slid down the stairs and you got the hard medicine, realized that both your knees were buckled.
Yep.
And then so how'd you get the scar on this one? That was some surgery?
Yeah, so that was goes all the way up, if you can't see. Repairing the quad tendon, because the quad tendon is separated too. Yeah. So when all that shifted, the quad tendon ripped right off there. And so they had to reattach the quadricep tendon. So that was one of the things they did in the ER, and they left the rest.
So then some chronic pain and reduced mobility, reduced workload, like you can't use it the same because it hurts.
I can't twist it because it can pop out. It was dislocated also. I mean, anything you could think of is basically what happened. So it came completely separated. and they got it to pop back into place, but it can pop out at any time if I twist it, put too much workload. And especially when it's colder, it takes a good 20 minutes or so to get out of bed and get it warmed up and move it. And I can't do a squat. I could do body weight squats, but I use my glutes a lot.
Yeah.
And then I always use this more. It's a lot more atrophied on this side versus the right leg too.
Okay, so I have a confession to make. So I know Trev has a situation, and I invited him down here. So what happened when you came down here? We did a couple things. Want to let everybody know what went down?
So we did. I mean, aside from the shoulder, placenta, and the intravenous stem cells, we did the PRP, the stem cell, and the hyaluronic acid, and they did the injection inside the kneecap. So they go between here and the actual joint itself. It goes right in between there, and they stick a needle in. So they do the PRP where they draw your blood, and they basically put it through a spinner, and then they get it's plasma enriched platelets, and they
Yellow
inject
gold.
that, pretty much, and it causes that inflammation response with the local growth factors to take in place, and then they give the stem cells, which are the things that can actually.
They mixed that, right? Like it was like you had a massive needle of it.
It was There's like looked like 20 cc's.
I don't know if it was that much. It was a lot though.
Yeah.
We got the video. We'll put up the clip.
So I've heard. I mean, Kevin Leveroni got the PRPs done, and he was back to training on his legs.
Right.
And then I've heard people just doing the stem cells, and they were back to training. So they did both, which causes the inflammation and the local growth factors. But then you're also giving the stem cells in there to create the actual healing, to be the food for healing, and because that area doesn't have a blood supply, and they were talking about the only way it heals is from diffusion or whatever. And but then not only that, they put the hyaluronic acid in, and what that does is it's lubrication basically. So that sits in between the joint, and it takes a good 6 months to however long.
There's people that just do the HA treatments just to relieve pain. Like that's what people use that all the time.
So where that cartilage and that padding is supposed to be, basically, the hyaluronic acid is in there as the padding. So that's like a lubrication. When you hear people taking nandrolone because it'll increase fluid retention in the joints, well, this is not just fluid, it's the hyaluronic acid. It's like a gel that draws fluid there. So it lasts longer, and it sits in there, and this gel is like a lubrication, so your joints aren't grinding on itself, basically. So they did it all 3 in 1, and that's what I got done when I first got here.
Okay, so then all 4 of your, like both shoulders, both knees issues, and then we only did one. We did the worst knee and the worst shoulder, and guess where the problem areas are now? In the opposite one. So now he's like got the reverse chicken wing going on. It's like he told me how strange it is the last week he's been doing cardio on that even a little bit.
Yeah, so now I'm only feeling the other body parts, which they always hurt, but I never even focused on it. I couldn't even feel pain because the other ones were hurting too much.
Like the override on the other side, but now it's like reversed on it.
And so now this one is, my knee actually every day is getting better. It took a good, almost 2 weeks to really fully start to feel it, but every day it's getting better and better than it was before.
You were pretty buckled right after it though.
So
it was. I remember you were right to
for
bed. It felt good for a bit. You're like, this feels smooth, and then it swelled up a bit, right?
So,
you're out for count.
Because I mean, if I even do too much walking on this leg, this knee will swell up just from walking. So just introducing that trauma to it, it swelled up for a good almost a week. Like 5 days it was pretty swollen, and then it went down. But I couldn't walk on it that night. The next day was pretty rough. After 2 days, it was starting coming back to normal faster, and I was just dealing with the pain from inflammation, which is just all that water retention going to that area. It makes it painful, and I get that all the time. That was normal. And
it's about the same time frame. Like grandma, like the doctor's mother-in-law, grandma we call her. She came down, and she's 90 years old, been on a cane for however long, and she did the treatment at the exact same time. And she lost the cane. She's off the cane now. She's like another success story. We'll put the clip up. And but she had the same type of pain. It was actually funny. She got it done before Trev. So on the way out of the hospital, Trev's helping her out, helping her out because she can't walk right. And then not 3 hours later, I'm helping Trev walk down the street because he can't walk right because there's just that delay on it. But yeah, so I don't know. Maybe it's got to get a little bit worse before it gets better.
Yeah, so it's just inflammation. They're sticking 20 cc's of fluid in between my joint. It's going to cause inflammation no matter what. You stick a 18 gauge needle through there, it's going to do that. But every day it's getting better. I can do a body weight squat, and I don't even feel it in my knee anymore. So this knee, I've never, even before my injury, I was having knee pain. and that was probably why most of that cartilage was even grinding out in the first place. So I'm not even feeling this knee anymore. I'm only feeling the other knee and the other shoulder, which weren't the big problems in the first place. But now that's all I can feel.
So there's people that get like, you know, great relief just off the PRP for years. You know, like you were mentioning the Brony, but like I know lots of other stories of the doctor's wife who administered was telling me she had, you know, 3 years just the PRP feeling fine. So it's also trying to regenerate, stimulating regeneration in the area, but then, you know, we add the proper stem cells, mesenchymal stem cells in the area that are just dying to turn into whatever they need to turn into, you know, so it's hopefully, well, not hopefully, it's proven that they'll definitely, you know, assist in that and treat that better than just the PRP, or definitely better just than the HA, so.
And then you have the hyaluronic acid taking a lot of the inflammation, the natural inflammation from wear and tear. Just by getting rid of that, what helps with the healing itself. So you're taking away that everyday stress of the joint grinding on itself while the PRP and stem cells are trying to do its job. So you take that much away from it, from having to go and help and heal that, and you're getting much more function, plus faster pain relief. So it's not just, I thought it was just pain relief from the hyaluronic acid, but then the PRPs, because the doctor's wife had it done too, and she was good for 3 years before she had to get it redone. And that was just straight PRP. So that, they said, worked just as fast. So I do know the PRPs and stem cells are working, and the hyaluronic acid is just kind of a plus to that.
Okay, so we'll get the other sides taken care of, and you'll be back to Bionic Trev there, hopefully. Maybe get some squats one day, get the legs a little bit back to their former glory.
Yeah, that would be nice.
Yeah, it's not like that, you know, they didn't, for, you know, you're massive up top, so they look a little tight, but not even. But 280, you must have been a force to be reckoned with. Anyway, when you guys need the things that you need to succeed, we're going to leave all the information down in the description of how to get a hold of us, the websites and everything. And look forward to talking to you guys later, right? Don't be worried if you got some health situations. There's lots of new stuff on the horizon to help you out. Treating everything, all right? Adios. Hey guys, for more informational videos discussing effective mesenchymal stem cell therapies here in Mexico, please go ahead and like the video and subscribe for future videos. Regenamex.com, longevity and quality of life specialists. Adios.